Is it really over now?
Some of you may lie awake at night, unable to sleep, haunted by a secret worry that suddenly strikes, perhaps in front of the mirror, or maybe during a shower, or as the night deepens. Has my penis size really shrunk? This question isn't just a matter of feeling down. This uncomfortable, anxious feeling isn't just your imagination. It's evidence of real changes happening in your body. And more importantly, these changes can be reversed. Hello, I'm Drive Park, a urologist with over 20 years of experience treating countless patients. Today, I aim to reveal the truth about a concern that no one has accurately addressed, yet countless middle-aged men secretly suffer from. Rather than simply prescribing medication or recommending surgery, I will provide you with the scientific and practical answers. Why your body is undergoing these changes and how you can regain vitality and confidence. Feeling that your penis size has decreased with age is not unique to you. And this video isn't just something to hear and forget. It will be the first step to fundamentally changing your life. Let's begin now. Many middle-aged male patients who visit my clinic share a common concern. It's something too embarrassing to reveal outwardly, something difficult to even tell their wives. Their worries about penis size. Countless men sigh, saying, "It's not like it used to be. It feels like it's shrunk." Beyond the physical changes, the psychological pain this causes is unimaginable. The sense of atrophy and loss of confidence that accompany declining erectile function inflict a devastating blow to a man's self-esteem. It creates problems in relationships with partners and can sometimes even lead to depression. One male patient in his 50s told me, "Doctor, I feel like I'm not a man anymore. I feel ashamed to even look at my wife. I dread nighttime." I could see deep despair in his eyes. This isn't just his story. Countless middle-aged men suffer alone in this silent agony, unable to speak of it to those around them. This issue isn't merely a physical phenomenon, it's a critical matter, directly impacting your quality of life and happiness. Yet we've hushed it up, pretending it doesn't exist. There's no need to hide anymore. I want to make it clear the pain you feel is absolutely not all in your head. It's the result of real changes happening inside your body. And understanding those changes is the first step toward recovery. So why do these secretive and painful changes occur in our bodies? There are 4 very specific medical causes for why middle-aged men feel their penis size has decreased. Causes too concrete to simply blame on age. Only by accurately understanding these causes can we develop effective recovery strategies. First, reduced blood flow. This is the core cause with the most direct and critical impact on penis size and erectile function. As we age, blood vessels lose elasticity and begin to narrow. When less blood flows from the heart to the penis, it naturally fails to expand fully during erection, and its flaccid size also diminishes. The penis needs to fill with blood like a sponge to grow larger, but without adequate blood supply, it cannot fully perform this function. Smoking, high blood pressure, diabetes, and hyperlipidemia are the main culprits that further accelerate this reduction in blood flow. Your penis itself is essentially a cluster of small blood vessels, making it an indicator of overall vascular health. Second, pelvic floor muscle weakness. Many may be hearing the term pelvic floor muscles for the first time. However, these muscles play a crucial role in maintaining erections, achieving orgasm, and supporting the penis. The penis is supported by the pelvic floor muscles. When these muscles weaken, the penis may droop downward or lose its former erection angle. If you experience a feeling of weak downward pressure during erection, or difficulty maintaining an erection, pelvic floor muscle weakness may be suspected. It's akin to the pillars supporting a building weakening. If the pillars weaken, the building would appear to tilt or collapse, right? Third, decreased skin elasticity. The reduction of collagen and elastin fibers in the skin as we age is a natural part of the aging process. The skin around the penis is no exception. When skin elasticity decreases, the penis may appear saggy or wrinkled when flaccid. This factor makes it appear visually smaller, rather than an actual reduction in size. It can be likened to a balloon deflating and becoming wrinkled. Fourth, increased lower abdominal fat. Lower abdominal fat, commonly referred to as a pot belly or beer belly in middle-aged men, goes beyond being merely an aesthetic issue and directly impacts genital size. The base of the penis is actually deeply embedded within the pubic bone. However, when significant fat accumulates in the lower abdomen, it covers this pubic bone area, obscuring the portion of the penis exposed externally. While the actual length remains unchanged, it appears shorter because it is buried beneath the fat. As the visible length decreases, it creates the visual perception that the penis size has diminished. Considering these 4 causes together, the anxiety you feel is not all in your head, but the result of physical changes with clear medical basis. The important thing is that these changes are not irreversible. There is hope they can be sufficiently reversed. From here on, I will provide specific, practical solutions to help you rebuild your self-esteem and regain your vitality. There's no need to despair. It's time to share some hopeful news. If you understand the 4 causes mentioned earlier, it's now time to start specific routines that address those causes and help you restore your penis size and self-esteem. These routines are based on scientific evidence, and if practiced consistently, you will definitely feel a noticeable change. First, pelvic floor muscle strengthening exercises, also known as Kegel exercises. Many people think Kegel exercises are only for women or those with urinary incontinence, but that's absolutely not true. For men, Kegel exercises have amazing effects on genital health and erectile function. Let me show you how. Have you ever tried stopping your urine flow midstream? The muscles you use then are your pelvic floor muscles. Remember the feeling of tightening your anus or stopping the urine stream. Contract that muscle for 5 seconds, then relax for 5 seconds. Repeat this cycle. Aim for 3 sets of 10 repetitions daily. You can do it anytime, anywhere, even while driving or watching TV. This training strengthens the muscles supporting your genitals, helping to trap blood longer during erections for firmer, longer-lasting results. You might not feel the effects immediately, but consistency is key. Restoring these muscles will bring immediate changes to your sex life. Second, adopt lifestyle habits to improve blood flow. Blood flow is the alpha and omega of penis size and erectile strength. Maintaining healthy blood flow is the direct path to penis recovery. Consume foods beneficial for vascular health. Nuts, oily fish, vegetables, fruits, and whole grains keep blood vessels clean and aid circulation. Berries and dark chocolate, rich in antioxidants, are especially beneficial. Conversely, reduce saturated fats, trans fats, and excessive sodium intake, as they damage blood vessels. Regular exercise. Aerobic exercise enhances cardiovascular health and boosts blood circulation. Practice consistent aerobic exercise like walking, jogging, or swimming at least 3 times a week. Strength training is also important. Increasing muscle mass boosts overall metabolism and positively impacts testosterone production. Adequate sleep. Sleep is when all bodily organs, including blood vessels, recover and recharge. Getting 7 to 8 hours of sufficient, high-quality sleep daily is essential for reducing stress, balancing hormones, and improving blood flow. Sleep deprivation can cause chronic inflammation and harm vascular health. Quit smoking and limit alcohol. Smoking directly constricts and damages blood vessels, while excessive drinking strains liver function and harms vascular health. These 2 are enemies you must avoid. Third, practice self-touch training and manage lower abdominal fat. Self-touch training. This does not simply mean masturbation. It means taking time to gently stroke, explore, and connect with your own body, especially your genitals. This helps awaken sexual nerves, strengthen the connection between genitals and the brain, and increase sensory sensitivity. It also plays a crucial role in forming a positive perception of your body and restoring self-esteem. Beyond fixating on genital size, practice focusing on your body's sensations and responses. After your daily shower, take time in front of the mirror to gently massage your genitals, reconnecting with their presence and accepting them positively. Managing lower abdominal fat. Reducing belly fat goes beyond merely increasing the visible size of your genitals. It positively impacts overall health and male hormone levels. Combine the previously mentioned dietary management with aerobic exercise to gradually reduce belly fat. As belly fat decreases, the base of your penis will become more visible, making it appear significantly longer visually. This will bring both tangible changes and psychological satisfaction. These 3 routines are organically interconnected. Strengthening the pelvic floor muscles enhances erectile function, improved blood flow supports overall genital health, and self-touch combined with fat management boosts visual satisfaction and self-esteem. All of this depends on your willpower and consistency. Thank you for watching.